cell count. As you can identify in this peripheral blood picture, this is the normal RBCs. This is the dot-like platelet normally found in the blood. And you can see this large cell, which are the white blood cells, leukocyte. Which type of it? Neutrophil. How can you recognize the neutrophil? Segmented nucleus, or having 3, 4, 5 loop. So here we have 4 loop, here we have 5, here we have 5. This is neutrophil. So in inflammation, there's transformation of blood content from the blood vessel to the interstitium, forming exudate or plasmate due to leakage of blood content from blood vessel to the interstitium. Here you can see the exudate composed of inflammatory cell and proteinaceous material. So this is the proteinaceous material, and these cells are inflammatory cells. So how inflammation happens? How we have swelling, redness, hotness? This is normal blood vessel. The blood usually run in the central part of the bloodstream. So when it vasodilates or endothelial cell contracted, reaction of inflammation by mediator like histamine, prostaglandin, NO, which cause vasodilation, and endothelial contraction by also histamine, leukotriene, bradykinin, platelet activating factor. So by this, the blood leak from the blood vessel to the interstitium, here the interstitium. This is neutrophil, RBCs, and this form accumulation of the fluid within the interstitium. So how leukocyte migrate from the blood vessel to the interstitium? By process of migration, rolling, adhesion, diapedesis, and phagocytosis of the microorganism. Margination happens usually, as I told you, the blood usually run in the central part. Due to disturbance of the vascular wall, it causes margination of neutrophil. And by adhesive molecule contact to the endothelium, what will happen? Rolling, the intimate adhesion, and by chemotactic agent will identify the microorganism, phagocytosis, then lysed by lysosomal enzyme. So here, this is the blood vessel. You can see the inflammatory cell marginate attached to the endothelial cell, and here they marginate and will transform to the interstitium. So here another example of inflammation. This is the fibrin mesh found in the inflammatory area. This one is fibrin mesh, and these all are inflammatory cells, mainly composed of neutrophil, lymphocyte, and plasma cell. So we'll perform a gram stain to identify the microorganism, which is, as you can see here, dot or cocci-like here within the white blood cell. We have what's known as complement system. It's composed of alternative and classical pathway. What are complements? Are protein found in the blood vessel in inactive way, or inactive protein synthesized by the liver. So it's activated when there is a microorganism or immunocomplex formation. This is the microorganism, and this is the immunoglobulin attached to the bacteria or organism, and by that the complement will be activated. My C1 will be active, and then by a cascade will activate all complement to C9. And it's important in the process of killing of microorganisms and as a chemotactic and an opsonizer agent. Here in this photo, this is the white blood cell, supposed to be the microorganism. It will phagocytose and release some lysosomal enzyme and free radical to lyse this organism. Here an example of inflammation. This is a blood vessel, but as you can see, it's not abnormal. The normal lining of the layer of the blood vessel is destroyed by inflammatory cell, and the lumen is not empty, it's filled by thrombus. This is the higher power of the previous photo. This layer are disrupted by RBCs and inflammatory cell. This is the neutrophil fragmented due to attack of the wall. So fragmentation of neutrophil side of vasculitis. In inflammation, we have a lot of number of inflammatory cells, neutrophil, plasma, lymphocyte, and macrophage. In this picture, you can identify the neutrophil by forming 3, 4, or 5 loops, as it's obvious here. This is 5 loops, so it's neutrophil. And this one here, we have 4, this is neutrophil. So how can you identify the plasma cell? This one is plasma cell. Cytoplasm is more bluish, so it's basophilic. And the nucleus are cartwheel appearance, clumped chromatin, forming a cartwheel appearance, and perinuclear halo, an empty area around the nucleus. So it's plasma cell. This one and this one are macrophage, larger size, and within it you can see the neutrophil, fragmented nuclear fragment, this one, and this RBC. So it's most likely macrophage. This is one sign of inflammation. As I told you, swelling. You can identify it by physical examination, by pressing by your finger on the patient area of swelling, and it will leave a depression. So it's called pitting edema. This is another example. Collection, quiet please. Another example of inflammation, what we call it blister, collection of fluid within the interstitium. And this is other example of inflammation in the larynx. You can identify the difference between this area and this area. This is normal, and this one is reddish and swollen. And it's life-threatening condition. We have also accumulation in the fluid within the human body cavity, thoracic, abdominal cavity, and in this area, this is thoracic cavity, and supposed to be filled by the normal lung. This lung is compressed by this fluid. So this fluid is clear. Excuse me? This fluid, as you can see, it's clear. You can see behind it. So it's serous fluid. When we call it serous fluid, when there is little amount, less amount of protein and inflammatory cell. So this one type of fluid. The other one is the serosanguinous effusion or fluid accumulation. Here you can also see that thoracic cavity and the lung is compressed by the fluid, which is hemorrhagic. So we call it hemorrhagic, meaning a lot of content of RBC. So we call it serosanguinous effusion. This is another example. You can identify easily the whitish color of the fluid, and we call it chylous ascites or chylous fluid. It is mainly from the lymphatic system, so it looks whitish. This area indicates in the pericardial area. You can see this streak or stringly pale fibrin, which indicate the presence of exudative fluid. Exudative means a lot of number of protein and inflammatory cells. Here under the microscope, the same area I described to you in the previous picture, this is the fibrin or stingingly pale streak. This is example of inflammation. You can identify this is the colon, and it's red with purulent material, greenish, yellowish. Under the microscope, you will see a lot of number of inflammatory cells. And here you can see the fluid is yellowish, which indicates purulent exudate. Purulent means a lot of number, or large number of acute inflammatory cells. Here another example at the cerebrum. You can hardly identify the sulcus, which is covered by purulent exudate. That means a lot of inflammatory cells. Here in the abdominal cavity, you can see this yellowish material, and it's also an example of exudate, purulent exudate. Also, you can see under the microscope in the alveoli, here, a lot of number of inflammatory cells, neutrophil, this is neutrophil, composed of 3 loop, plasma cells, and lymphocyte. Here an example from the gallbladder. This is the normal lining of the gallbladder, anterior side, and between the side, normal side, you can see smaller cell with also 3 to 4 loop here. You have 4, and this one 3. This is inflammatory cell infiltrating between the normal epithelium. So it's an example of acute inflammation. Here also within the alveoli, larger number of inflammatory cells, with a dilated capillary. This is dilated capillary. So complication of acute inflammation, it can form abscess, which is a collection of inflammatory cells within the tissue of the brain, tissue. Here another example, this one, and this one are example of abscess formation. Here smaller abscesses are seen or can be identified. Under the microscope, you will see this, a collection of, or localized collection of neutrophils surrounding this purple area or indicate the presence of the bacteria. Here another example of a small abscess formation in the lung parenchyma. This one are cyst-like collection of a fluid. Under the microscope, you will see a lot of number of inflammatory cells, mainly neutrophil. Here another example, this is inflammatory cell, and here this is darker area are bacteria. Also, the acute inflammation can be complicated by forming ulcer. This is the epithelium lining, and you can identify this discontinuation here, which indicate the presence of ulcer. This is another example of forming an ulcer. Here in the larynx, you can see this normal lining epithelium, but here we have discontinuation of this normal lining by forming an ulceration. So what you will see under the microscope, this here forming an ulcer, this is the normal epithelium lining here, but this epithelium lining is absent here. So this means we have an ulcer formation. Under the absence of the normal epithelium, here we have a collection of neutrophil and fibrin. Ulcer also can be seen in the lower limb, for example, here in a diabetic patient. Usually, diabetic patients have atherosclerosis and blood vessel abnormality, which lead to formation of ulcer. Here we have a large ulcer, discontinuation of the normal epithelium. Another complication of inflammation are gangrenous formation, which is extensive necrosis. You will see the skin is darker in color compared to the normal one. And we have different type of ganglion. We have wet, dry, and gas gangrenous. So here we can see or identify a large area affected of skin by large ulceration. Okay, any question?
مفيش عندك صور تقلبش المعدة.